Hi, I'm Dr. Harbir Singh, live here at the Digital Health Summit Studio here at CES 2020. We're here today with Lygeria Ricciardi, Chief Transformational Officer at Carium. Lygeria, it's a pleasure to meet you.
Thank you. It's exciting to be here.
Yeah, so tell us a little bit more about who you are and what you're doing at Carium.
Sure. So, my background is in using technology and digital health to empower consumers and patients to be more engaged participants in their health. I've spent a number of years in policy and working at this problem from a lot of different angles. I've been at Carium for about, more than a year. And what's super exciting about it for me is that it's an opportunity to build through technology some of the ideas that I've worked on from a more global sort of 30,000 foot view previously. Like now I have the chance with a team of technology experts to actually find ways to empower consumers by enabling them to be real collaborators in their care. So it's basically a platform for collaborative care that links providers and consumers throughout whole life.
Oh wow, that's fascinating. And that seems to be the entire theme of this conference is, how can we retailize and consumerize healthcare and give the consumers and the patients more power in their care to communicate with providers, get feedback from the digital health therapeutics and the digital health analytical tools that they have.
Yep.
So you were hosting a panel on AI?
Yep.
And so I've been hearing lots of interesting things about it. So what are some of the key points and takeaways from that conversation?
So AI is obviously a very broad topic, artificial intelligence. On my panel, I had a variety of different types of speakers, a large health plan, Humana, Philips, a large tech company, and a smaller tech company called Neofect that helps people rehabilitate from stroke and other injuries using gamification. So we had a wide-ranging discussion about some of the promises and pitfalls of AI. And on the plus side, the panelists were really excited about how they're already using technology to really personalize care and to learn a great deal about the individual, as well as really understand populations at a broad level. Obviously, that's exciting, as well as the capacity to just churn through a lot of data really quickly when and where it's needed. Among the things we talked about on the risk side were, of course, data quality, but there was an exciting sort of wraparound, I thought, around that, which is the context of the data. So even if all the quality of the data is right, if you don't know that you're getting a crazy heart rate because someone is rushing somewhere because they're late, you may not understand what's going on. And that makes sense, actually, tying back to what we do at Carium. It's kind of, you need to understand the context of anyone within their life to understand what's going on with their health at that particular moment.
So, one of the interesting things about healthcare and data is that, particularly insurers like Humana or United Healthcare, they have large troves of patient data, right? But we traditionally have not been able to process it and understand it.
Yeah.
And now it seems like the artificial intelligence, machine learning algorithms are finally able to process some of that data. So where do you think we are in processing it, and where do you think that future is?
Baby steps. We've already made huge gains, and we're able to use data as never before, and yet I think that's going to change really quickly. We were talking about the fact on the panel that a few years ago, or even now, people will talk about, hey, wait a minute, AI is going to take over 80% of the work that providers do, and maybe doctors will be out of work, and all these other things will happen. I think our sophistication of how we can apply tools has become a lot more, has become sharper. So we're able to use it to augment human intelligence in really good ways, crunch through the data and make sense of it. It's always going to require a human to interpret it, though.
Right.
And even more so as the sources of data are proliferating. Here at CES, you can walk around, halls and see all kinds of futuristic, crazy things, many of which have sensors and are bringing in new sources of data all the time. So we need to keep reevaluating what data is important, how do we use it, how do we apply it to real people's lives.
Wow. Yeah, I mean, it's definitely a very exciting time. And, one other interesting thing that had come up is this concept of, interaction between human and machines and machine.
Yeah.
What are your thoughts on that?
So, as I was saying, I think you're always going to need a human to make judgments about what is relevant and what makes sense in this idea of context. At the same time, too, even though machines are evolving quickly, there's an element of humanity that has to do with empathy and care and excitement and enthusiasm that I don't know if I want to say that no machine will ever have, but those are elements of humanity that are really core.
Yeah.
And we can use technology to augment and extend our humanness as opposed to challenging it. And I think that's pretty exciting.
Yeah, that's spot on. You know, we're not going to get replaced by the machines. So
Hope not.
that's good to know. Well, thank you so much for your time here. It's been a pleasure chatting with you.
Thank you.
Yeah. I'm Dr. Harbir Singh, live here at the Digital Health Summit studio here at CES 2020.